Did you know that experienced doctors can often instantly spot potentially serious underlying health issues just by thoughtfully noticing certain, often subtle, hygiene mistakes in their elderly patients? These seemingly innocent personal habits, ones that might appear almost inconsequential on the surface, could actually be silently warning you of genuinely dangerous medical conditions that are actively developing within your body right now. What's truly frightening about this realization is that most seniors have absolutely no real idea that they're routinely making these potentially critical errors every single day without understanding the potential risks. If you find value in discussions that help you live a healthier life, please consider subscribing to Old Age Wisdom today. In the next few minutes, I'm personally going to reveal the 7 most common personal hygiene mistakes that astute doctors immediately notice in their elderly patients. And even more importantly, precisely how thoughtfully fixing them could literally save your life, or significantly improve the valuable life of someone you deeply love. The incredibly important information I'm about to openly share with you isn't typically taught in schools, is rarely discussed in busy doctors' offices, and is almost never even casually mentioned in mainstream health magazines. Yet, knowing these specific facts could realistically be the actual difference between truly living your precious golden years in vibrant health and sadly suffering from painful and entirely preventable conditions that actively rob you of your precious independence and your hard-won dignity. Let me tell you a personal story about Harold, a vibrant 75-year-old retired engineer who mistakenly thought his established personal care routine was perfectly fine, exactly as it should be. Harold was always extremely active in his local community, enthusiastically played golf at least twice a week, and never willingly missed any of his beloved grandchildren's exciting baseball games. He maintained what he believed was a very respectable level of personal cleanliness. However, during what he sincerely thought was just a simple, routine checkup with his trusted physician, his doctor immediately spotted 3 very critical hygiene mistakes that thoughtfully revealed Harold had unknowingly been developing a rather serious underlying medical condition for several months without ever suspecting a thing. The doctor noticed subtle signs related to Harold's oral care, skin condition, and even the state of his fingernails, which, when considered together, painted a concerning picture. "I had absolutely no idea," Harold later honestly told me, his voice filled with disbelief. "I sincerely thought I was diligently taking good care of myself. If my caring doctor hadn't thoughtfully noticed these seemingly minor hygiene issues, I might not even be here today to share my story." Today, I'm thoughtfully going to share with you exactly what those specific, troubling mistakes were, so you can purposefully avoid Harold's potentially life-threatening and certainly frightening experience. But more importantly, I'll thoughtfully tell you precisely what proactive steps to actively take instead. Simple, easily implementable changes that could meaningfully add valuable, healthy years to your life. Thoughtfully starting today. Mistake 1. Neglecting proper oral hygiene. When was the last time you really looked thoughtfully at your toothbrush? Take a moment now. Is it noticeably frayed and worn out, with bristles pointing in all directions? Are you consistently brushing your teeth thoroughly, covering all surfaces at least twice a day? And here's the far more important, fundamental question. Did you know that poor dental care isn't just about inconvenient bad breath or the eventual, regrettable loss of teeth? It's actually directly linked to frightening conditions like serious heart disease, debilitating stroke, and even devastating cognitive decline like dementia. Neglecting your mouth's health can have severe repercussions throughout your entire body, far beyond what most people realize. Respected geriatric specialists at Harvard Medical School have definitively proven through extensive research that harmful bacteria originating from untreated gum disease, periodontitis, can actively enter your bloodstream. Once in circulation, these dangerous microbes can travel throughout your body, knowingly causing inflammation and contributing to life-threatening heart conditions, including infections of the heart valves and atherosclerosis, hardening of the arteries. In fact, their comprehensive research reliably shows that seniors with demonstrably poor oral hygiene are fully 3 times more likely to develop serious cardiovascular problems compared to those who consistently maintain proper dental care routines. But please don't just blindly take my well-meaning word for it. Let me share a poignant personal story with you about Sylvia, a vibrant 68-year-old retired schoolteacher from Oregon. Sylvia had carelessly ignored her bleeding gums for several months, mistakenly thinking it was a more or less normal part of gracefully getting older, something many seniors unfortunately assume. "I just mistakenly figured that's what naturally happens when you get older," she candidly said, dismissing a clear warning sign. However, during a routine physical examination, her concerned cardiologist unexpectedly discovered dangerous inflammation in her delicate heart valves, directly caused by oral bacteria that had somehow traveled all the way through her circulatory system from her infected gums. The doctor thoughtfully told her that, had she only waited just a few more months to seek appropriate medical and dental treatment, the resulting damage to her heart might realistically have been completely irreversible. So, what should you proactively do right now to diligently protect yourself from these hidden dangers? Our mission at Old Age Wisdom is to share helpful content for seniors. Please consider subscribing and liking our videos. First and foremost, thoughtfully examine your current toothbrush. If it's more than 3 months old, or is clearly showing any visible signs of significant wear, like frayed or flattened bristles, conscientiously replace it immediately without further delay. Ideally, consciously switch to an electric toothbrush, which has been demonstrably shown to remove at least 62% more plaque than manual brushing, according to thoughtfully conducted studies at the University of Pennsylvania Dental School. Purposefully brush thoroughly at least twice daily, ideally after breakfast and before bed, for a full 2 minutes each time. Consider setting a timer if you consciously need help ensuring you brush for the recommended duration. Thoughtfully floss every single night without conscious exception, making sure to gently curve the floss around each tooth. And diligently make sure that you never skip your carefully scheduled dental checkups and professional cleanings, typically every 6 months, even if you currently have well-fitting dentures. Have you thoughtfully noticed any unexpected bleeding when you brush or floss? Have you observed any unexplained swelling or tenderness in your delicate gums? These aren't somehow normal signs of natural aging. They're valuable warning signals your precious body is thoughtfully sending directly to you. Please don't knowingly ignore them for even one more day. Schedule a dental appointment promptly. Mistake 2. Infrequent bathing and skincare. Now I want to ask you to be very honest with yourself. How often are you meaningfully bathing or showering? Many seniors, for various perfectly understandable reasons such as mobility issues, fear of falling, or skin dryness, consciously reduce their bathing frequency as they thoughtfully age. But did you consciously know that your skin is actually your largest and most exposed organ, acting as a critical barrier and reflecting your internal health? Consistent changes in its readily visible condition can reliably reveal serious underlying internal problems long before any other more specific symptoms even appear. Respected dermatologists from the world-renowned Mayo Clinic have consistently warned that reduced bathing frequency in seniors often sadly masks the early and readily detectable signs of significant conditions like diabetes, which can cause skin infections and slow healing, worrisome liver problems, often indicated by jaundice or itching, and previously undiagnosed cardiac issues, which might manifest as skin discoloration due to poor circulation. Their insightful clinical studies have reliably revealed that nearly 40% of previously undiagnosed medical conditions in elderly patients could have been proactively caught remarkably earlier through consistent and purposeful skin observation during regular bathing. Our goal at Old Age Wisdom is to share helpful information like this. If you agree, please share this video with your friends and family. Consider, for example, what thoughtfully happened to Clarence, a vibrant 77-year-old retired postal worker from the state of Michigan. Clarence carelessly thought bathing just once a week was meaningfully sufficient, especially during the long winter months, when his skin often felt noticeably dry and somewhat itchy. "I just simply didn't want to dry out my sensitive skin even more," he thoughtfully explained, a common concern among older adults. But when his astute physician consciously noted unusual, subtle skin discoloration during a routine appointment for an otherwise unrelated matter, further, more specialized testing thoughtfully revealed previously undiagnosed, early-stage kidney disease. The concerning skin discoloration wasn't directly caused by poor hygiene itself. Rather, the regrettably infrequent bathing had effectively masked a vitally important symptom that could potentially have been readily spotted weeks, or perhaps even months, earlier, allowing for earlier intervention and management. So, what's the clear solution to maintaining both skin health and cleanliness? Thoughtfully establish a reasonably regular bathing schedule for yourself, actively aiming for bathing or showering at least 3 times weekly, even if you're not particularly active or don't feel physically dirty. On non-bathing days, a gentle sponge bath focusing on key areas can suffice. Diligently use a consistently mild, fragrance-free soap or cleanser that thoughtfully won't strip your valuable skin's natural protective oils. After thoughtfully bathing or showering, proactively apply a quality, hydrating moisturizer while your skin is still slightly damp. This simple step helps diligently lock in much-needed hydration and keeps the skin barrier strong. And perhaps most importantly of all, meticulously examine your precious skin regularly, perhaps weekly, looking closely for any unusual changes in color, like new spots, moles, or widespread discoloration, texture, excessive dryness, scaliness, thickening, or unexpected sensation, persistent itching, numbness, tenderness. Are you thoughtfully noticing any dry, flaky patches that don't improve with moisturizer? Any unusual and unexplained skin discoloration? Any localized areas that persistently itch without an obvious cause? These might knowingly be your body's valuable way of thoughtfully alerting you to something far more serious and potentially harmful happening internally. Please don't consciously wait another single day to thoughtfully address these potentially valuable warning signs with your doctor. Mistake 3. Ignoring nail care. Take a brief moment right now, perhaps pause the video, to carefully look at your fingernails and toenails. What do you thoughtfully see? Are they thoughtfully and neatly trimmed? Are they carefully cleaned underneath? Are they conscientiously free from any noticeable discoloration, ridges, or thickening? The overall condition of your precious nails is often a surprisingly valuable window into your overall systemic health, a readily visible indicator that trusted doctors thoughtfully check immediately when thoughtfully evaluating their elderly patients for underlying conditions. We strive to bring you valuable content. Please consider subscribing to Old Age Wisdom. According to the respected American Academy of Dermatology, easily noticeable changes in your nails, their color, shape, texture, or thickness, can realistically indicate over 20 distinctly different systemic diseases. These range from relatively common issues like anemia, often causing pale or spoon-shaped nails, and troublesome thyroid issues, which can lead to brittle or separating nails, to more serious conditions like dangerous heart disease, sometimes indicated by bluish nail beds, or lung problems. Their thoughtful research carefully shows that, in valuable patients over the age of 65, sudden and previously unexplained nail abnormalities frequently led to the reliable diagnosis of previously undetected internal medical conditions in nearly 30% of cases. This highlights just how important paying attention to your nails can be for early disease detection. Let me briefly share Beatrice's deeply personal and illustrative story. At the age of 82, Beatrice honestly didn't think her noticeably thickening, yellowing toenails were particularly concerning. She simply stopped wearing open-toed sandals and consciously hid them away in closed shoes, hoping no one would notice. "I just figured it was simply part of getting older," she thoughtfully told me later, echoing a common misconception. But when she finally saw a skilled podiatrist for persistent foot pain, the doctor immediately diagnosed a severe fungal infection, onychomycosis, that had unfortunately been allowed to flourish untreated for so long that it thoughtfully revealed her severely suppressed immune system. Subsequent, more thorough testing quickly uncovered a serious underlying autoimmune condition that thoughtfully required immediate and targeted medical treatment. So, what should you thoughtfully do, starting today, to maintain healthy nails and potentially catch health issues early? Thoughtfully trim your nails regularly, cutting them straight across with slightly rounded edges to prevent painful ingrown nails, especially on your toes. Carefully keep them meticulously clean and, importantly, carefully dry, as moisture can encourage fungal growth. Wear thoughtfully breathable footwear made of natural materials, and diligently change your socks daily, especially if your feet tend to sweat. And absolutely never knowingly ignore significant changes in your nails' color, yellowing, darkening, white spots, texture, brittleness, ridges, pitting, or thickness. These aren't merely superficial cosmetic issues. They're potential warning signals directly from your body, indicating that something might be amiss internally. Are your nails currently noticeably brittle, strangely discolored, or unusually thickened? Remember, these significant changes aren't inevitable parts of natural aging. They're potentially your precious body consciously trying to tell you something profoundly important. Will you thoughtfully listen and consult your doctor before it's potentially too late? Mistake 4. Improper incontinence management. This is perhaps the most emotionally charged and shocking hygiene mistake we'll discuss, primarily because of how incredibly common it unfortunately is and how desperately people purposefully try to consciously hide it due to feelings of shame or embarrassment. Over 50% of seniors are sadly and silently dealing with some form of troubling urinary or fecal incontinence. But the truly shocking part is how many purposefully hide it, choosing makeshift solutions or simply suffering in silence, instead of actively seeking appropriate medical evaluation and proper treatment. Highly respected urologists from the renowned Johns Hopkins Medicine consistently report that untreated incontinence frequently leads to dangerous skin infections, like painful sores and rashes, an increased risk of debilitating falls, often occurring when rushing to the bathroom, damaging social isolation due to fear of accidents in public, and can even effectively mask serious underlying medical conditions like urinary tract infections, bladder issues, or even concerning prostate cancer. Their comprehensive studies reliably reveal that seniors who proactively and properly manage their incontinence issues experience a remarkable 60% fewer associated complications compared to those who misguidedly attempt to hide the problem. If you would like to receive notifications on new videos, please subscribe to Old Age Wisdom today. Consider the poignant story of Douglas, a 73-year-old retired accountant from sunny Arizona. Douglas was far too embarrassed to even mention his occasional urinary leakage to his trusted family doctor. He purposefully resorted to using folded paper towels as makeshift protection and thoughtfully changed his clothes frequently throughout the day, mistakenly thinking he was effectively managing the problem on his own. When he finally sought medical help after developing incredibly painful skin sores in the affected area, astute doctors discovered an advanced prostate condition that realistically could have been diagnosed and successfully treated months, or even years, earlier, likely with significantly better long-term outcomes. "My foolish pride nearly cost me my very life," Douglas candidly admitted with deep regret. "I desperately wish I had simply talked to my doctor at the very first sign of a problem, instead of pointlessly trying to hide it out of sheer embarrassment." So, what should you proactively do if you're currently experiencing any form or degree of incontinence? First, and most crucially, please never feel embarrassed to openly and honestly discuss bladder or bowel control issues with your trusted doctor or healthcare provider. Rest assured, they see and compassionately treat these common conditions every single day. Diligently use proper absorbent products, pads, briefs, or protective underwear, specifically designed for managing incontinence, rather than relying on ineffective makeshift solutions like paper towels or tissues. Thoughtfully change these products promptly whenever they become wet or soiled, and carefully follow a proper cleansing routine using gentle, pH-balanced cleansers to diligently prevent painful skin breakdown and potential infections. Most importantly, please recognize that incontinence is not a normal or inevitable part of the natural aging process. It's very often a treatable symptom indicating that something underlying needs prompt medical attention. Are you currently experiencing occasional leakage, perhaps when you cough, sneeze, or laugh? Do you find yourself consistently planning your social outings around easy bathroom availability? Are you purposefully using makeshift protection to manage accidents? If so, please don't wait another single day to proactively speak with your doctor about these troubling symptoms. Your long-term health, dignity, and quite possibly even your life may actually depend on seeking timely help. Mistake 5. Ear hygiene errors. What's your typical ear cleaning routine? Please, be completely honest with yourself. Are you routinely using potentially dangerous cotton swabs, like Q-tips, carelessly inserting them deep into your sensitive ear canal in an attempt to remove wax? If so, you're making a surprisingly common yet incredibly dangerous mistake that far too many seniors unknowingly make every single day. All too many older adults are inadvertently damaging their precious hearing and sadly missing potentially crucial early signs of serious infection due to these widespread improper ear cleaning practices. Leading otolaryngologists, ear, nose, and throat specialists consistently warn that inserting anything into the ear canal can easily push earwax further in, potentially causing blockages, impaction, painful irritation, or even dangerous perforation of the delicate eardrum, all while potentially missing critical symptoms of potentially dangerous infections that require medical treatment. Their research clearly shows that improper ear cleaning techniques are responsible for nearly 40% of preventable ear canal injuries in patients over the age of 65, with many of these cases unfortunately leading to painful infections that could have been entirely avoided with proper care. Let me tell you about Patricia, a 71-year-old retired librarian from Washington State. Patricia regularly used cotton swabs to meticulously clean deep inside her ears, a habit she'd maintained for decades, until one unfortunate day when she accidentally punctured her eardrum. This painful injury led to a severe middle ear infection that subsequently spread to nearby tissue, requiring extensive medical intervention. "I had always cleaned my ears this way," she explained with understandable frustration. "No one ever explicitly told me it was actually dangerous." Patricia unfortunately required emergency medical treatment and ultimately suffered permanent hearing damage in that ear, damage that could have been completely avoided with safer hygiene practices. So what is the correct and safe approach to proper ear hygiene? Remember this simple, golden rule. Never insert anything smaller than your elbow into your ear canal. That means no cotton swabs, no bobby pins, no rolled-up tissue corners. Absolutely nothing. Gently clean only the outer ear, the pinna, with a warm, damp washcloth during your regular bathing routine. If you genuinely feel you have excess earwax buildup causing discomfort or hearing changes, use over-the-counter eardrops specifically designed to safely soften earwax, carefully following the package directions precisely. Then, allow the softened wax to naturally work its way out. Importantly, see a doctor immediately if you experience any ear pain, unusual discharge, ringing in the ears, tinnitus, or sudden hearing changes. Are your ears currently feeling unusually itchy, persistently full, or blocked? Are you experiencing any unexplained changes in your hearing ability? Please don't attempt to self-diagnose or resolve these potentially serious problems yourself. They absolutely require professional medical attention from a doctor or an audiologist. Your precious hearing is invaluable. Protect it diligently with proper, safe care. Mistake 6. Poor foot hygiene. When was the last time you really looked closely at your feet? Not just a quick, passing glance while putting on your socks, but a thorough, careful inspection of every single part, between the toes, the heels, the soles, and the toenails. Your feet contain vitally important clues about your circulatory and nervous systems, clues that astute doctors often check first when evaluating their elderly patients for potential health problems. Respected podiatrists specializing in geriatric care at the American Podiatric Medical Association strongly state that common foot hygiene issues often reveal the very first subtle signs of serious conditions like diabetes, peripheral neuropathy, nerve damage, and vascular disease, poor circulation. Their comprehensive studies clearly show that, in patients over the age of 65, implementing proper foot care routines and conducting regular self-inspections could potentially prevent up to an astounding 85% of diabetes-related lower limb amputations. That's not a typo. 85% of devastating amputations could potentially be prevented simply with consistent, proper foot care. Consider the case of Raymond, a 76-year-old retired factory worker from Illinois. Raymond had knowingly ignored the increasing dryness and seemingly minor cuts on his feet for years, mistakenly assuming they were just normal, unavoidable signs of aging. "My feet had honestly been looking pretty rough for years," he readily admitted. But when his attentive primary care doctor thoughtfully noticed their concerning condition during a routine physical exam, he immediately ordered comprehensive diabetes testing. This proactive measure caught the disease in its very early stages, a point where significant lifestyle changes could still make a substantial positive difference in managing the condition and preventing serious complications. "If my doctor hadn't specifically checked my feet during that visit, I might have gone on for years without even knowing I had diabetes," Raymond gratefully told me later. By then, the irreversible damage could have been truly severe. So, what should you proactively do, starting today, to protect your foot health? Diligently wash and thoroughly dry your feet daily, paying special attention to drying carefully between the toes where moisture-loving fungus often thrives. Inspect them regularly, ideally every day, looking closely for any cuts, sores, blisters, redness, swelling, or any changes in skin color or temperature. Wear clean, dry socks made of natural fibers, like cotton or wool, or specialized moisture-wicking materials. Apply a quality moisturizer to dry areas of your feet, but thoughtfully avoid applying it between the toes, as excess moisture there can encourage fungal growth. And absolutely never ignore persistent foot pain, numbness, tingling, or any wounds that don't seem to be healing properly. See a doctor or podiatrist immediately if you notice any of these warning signs. Are your feet currently dry and cracked? Have you noticed any small cuts or sores that aren't healing as quickly as they should? Is there any unusual discoloration or a noticeable loss of feeling in your feet or toes? Remember, these aren't just superficial cosmetic issues. They could very well be crucial early warning signs of serious underlying medical conditions that require prompt and immediate medical attention. Mistake 7. Medication-related hygiene issues. Are you currently taking multiple medications on a regular basis? Have you thoughtfully noticed any significant changes in your normal body odor, sweating patterns, or the dryness of your mouth since starting them? The very medications that are diligently keeping you alive and managing chronic conditions might inadvertently be causing noticeable hygiene problems that could potentially signal dangerous side effects or interactions. Pharmacologists at the respected American Geriatric Society have extensively documented how certain commonly prescribed medications, including some blood pressure drugs, antidepressants, and pain relievers, can unfortunately cause bothersome side effects like dry mouth, xerostomia, excessive sweating, hyperhidrosis, or distinct changes in body odor that could potentially indicate underlying issues or even medication toxicity. Their insightful research clearly shows that nearly 40% of adverse drug reactions in seniors initially present first as noticeable changes in personal hygiene needs before more serious or obvious symptoms appear. This highlights the importance of paying close attention to these subtle clues. Consider the story of Barbara, a 67-year-old retired nurse from Florida. Barbara's family had noticed an unusual body odor, which they unfortunately dismissed as simply poor hygiene. However, it wasn't until her astute geriatrician recognized it during an appointment that it was identified as a potential sign of medication toxicity, which was slowly but surely damaging her liver. "I was showering regularly and diligently using deodorant," Barbara explained, feeling frustrated and misunderstood. "I had absolutely no idea the unusual smell was actually coming from inside my body, not simply from a lack of cleanliness." Her case underscores how vital it is to consider medications as a possible cause of new hygiene issues. So, what can you proactively do to protect yourself from potential medication-related hygiene problems? Carefully track all hygiene changes after starting any new medications. Keep a simple journal, thoughtfully noting any significant differences you observe in your typical body odor, sweating patterns, mouth dryness, or even skin condition changes. Stay properly hydrated by drinking plenty of water throughout the day, unless otherwise specifically instructed by your doctor, as some conditions require fluid restriction. Report any unusual or persistent sweating, noticeable body odor changes, or severe dry mouth to your doctor immediately, as these could potentially indicate dangerous drug interactions or underlying toxicity issues. And absolutely never adjust medication dosages on your own without explicit medical supervision, even if you strongly suspect the medication is causing bothersome hygiene issues. Have you personally noticed any unusual body odor despite regular bathing? Are you experiencing excessive sweating, even when you're not physically active? Do you suffer from extreme mouth dryness that makes talking or swallowing difficult? Please don't automatically attribute these noticeable changes solely to normal aging. They could potentially be warning you of potentially life-threatening medication effects that require immediate medical attention and possible adjustment by your doctor. Now you know the 7 critical hygiene mistakes that doctors immediately notice in their elderly patients, and exactly how to proactively correct them. By thoughtfully addressing these important issues starting today, you can actively prevent potentially serious health problems, conscientiously maintain your precious dignity and hard-won independence, and potentially add valuable, healthy years to your life. Remember, proper personal hygiene isn't just about outward appearance or simple social courtesy. It's an absolutely vital part of proactively maintaining your overall health and well-being as you gracefully age. And implementing these relatively simple changes could literally save your life. If you found this valuable information helpful and potentially life-saving, please hit that like button right now to show your support. Has your doctor ever noticed any of these specific hygiene issues during your visits? We encourage you to thoughtfully share your personal experience, anonymously, if you prefer, in the comments section below. Your story might help someone else. Don't forget to subscribe to Old Age Wisdom and hit that notification bell to receive more potentially life-saving health information specifically tailored for seniors like this. And please, generously share this video with your beloved friends and family members who are over the age of 60. This vital knowledge could literally save their lives. Thank you so much for watching. Stay healthy, stay informed, and take wonderful care of yourself.